In addition to projecting to the suprachiasmatic nucleus, which regulates the circadian rhythm, they also project to another part of the brain, which has nothing to do with vision, called the perihabenular nucleus. And as you can see here, it is completely separate from the suprachiasmatic nucleus, but it is involved with mood. And so this is something that we see a lot of in the wintertime when people become depressed. And this is known as SAD, or seasonal affective disorder. This is one of the manifestations of not enough light getting to this area of the brain. Kyle, about 5% of the population get symptoms of seasonal affective disorder. And symptoms appear in these patients about 40% of the year. We typically see it more in females versus males. But when they did a meta-analysis of all of these studies that looked at light in these patients, about 173 studies that were identified, randomized placebo-controlled trials looking at the DSM diagnosis, and about 20 studies they showed something very interesting, that when they were exposed to bright light at about 3,000 lux hours, so that would be 10,000 lux for about 20 minutes in the morning, and they did it for at least 4 days, they were able to show very conclusively that overall with this meta-analysis, there was an improvement in the seasonal affective disorder with bright lights. Another way of doing this is something called dawn stimulation. You can see here on the chart that increasing light exposure automatically in your bedroom from about 0 initially to about 200 to 300 lux over a 1 to 2.5 hour period of time can also improve seasonal affective disorder, as we can see here again with this meta-analysis, where overall there was an effect size on these patients. So it's slowly bringing the lights up, and there's actually lights that you can program to do this sort of thing. In 2017, this paper was published looking at can proper light therapy affect bipolar depression. And this study showed that in 46 patients, which were randomized to placebo versus 7,000 lux bright white light versus 50 lux dim red placebo light, around 12 o'clock to 2:30 in the afternoon, 15 minutes per day, and then building up to 1 hour per day by week 4, you can see here that by week 4, there was a significant increase in the patients that were in remission from bipolar depression. That's a good thing. As the number goes up, that was good. And you can see that as the amount of light that was given to the patient increased after week 4, there was a much higher percentage of patients that were in remission who got the 7,000 lux bright white light in the afternoon. There was a paper that was published in 2010 that looked at artificial dawn for 2 weeks, 250 lux or 50 lux versus control. And what they saw was a significant reduction in sleep inertia. In other words, it was easier to get up. You weren't feeling like you were tired and you wanted to stay in bed. In the 50 lux and the 250 lux versus no dawn at all. And you can see here that very similar intervention, the dawn stimulating light, when they did this for 30 minutes prior to waking up and then 20 minutes after waking up, compared to a very small amount of light, they were able to show that this dawn simulating light improved subjective well-being, mood, and actually cognitive performance as compared with the dim light and the minimal blue light that they had as controls. I would just say, though, that this artificial light, this dawn simulating light, is really just a way of capturing what you would normally have if you were to go outside and expose your eyes to bright light outside early in the morning. So all of this is really to show that stimulating your eyes with bright light from the sun is very beneficial.